Education for young people is terribly important. Media messages are important. We are seeing more and more popular musicians, actors, and others coming into rehab for these kinds of conditions. We also need alternatives to the motivations that are producing the reasons that people are using these materials inappropriately. So we have to educate the medical folks, we have to educate the academic folks, and we have to have intense opportunities for people to explore either their psychological conditions, opportunities for athletic, non-drug performances, exciting educational experiences, a whole sense of environmental activities that can compete with the temporary highs coming from drugs. That can be creative kinds of experiences, etc. One thing that all the international communities and governments, non-governmental associations understand is that all of the effects of these substances when used non-medically are temporary. The positive results for the user are always temporary. And extensive and long-term use always leads to some kind of diminished capacity or dependence. And so it really pays for a nation, a state, a province to invest as much as possible in the prevention of these substances, the early intervention, so that they're not wasting a great deal of funds in the very, very difficult process of rehabilitation. We're starting to learn that now.
So to close off, Dr. Cohen, is there anything else that you can add? Your vision for what it's going to be like? Is the drug abuse going to be diminished? Is it going to expand and take us all over? What are your thoughts for the future? Where do you see this going?
You know, looking back, it's been relatively difficult to predict. What we can predict is that there will be a change in the fashionability of certain drugs. Some of the drugs, for example, PCP is one, that the effects have been so devastating that even the user culture has given up on them. So there's a certain learning that happens even among users who were fans of the drug that changes. The other thing we're seeing is the growth of synthetic drugs that may be in fact cheaper and more destructive. But we're also seeing a greater sophistication that the professionals, especially the medical professionals, the social workers, the psychologists, etc., are going to be much more alert earlier as these problems start to develop. So we certainly are not going to be able to make experimentation to zero. What we are going to be able to do is identify it quickly, to be able to intervene quickly and to have appropriate intervention techniques combined with young people, particularly young adults and others, being aware of side effects. And that goes for medical prescription drugs as well. So I think there's going to be more intelligence, more knowing, but the field is really going to have to be flexible, because as one drug gets popular, another loses its popularity. We see recycles of this. And societies have to be alert, but I am optimistic that we're going to make progress.
Thank you very much, Dr. Cohen. Thank you for sharing your ideas with us.
Can I have one question?
Yeah.
We all know that Trudeau is about to change the laws about marijuana, legalize it. So let's say if you had his ear, what simple advice would you give him to what way to go forward?
I would say that he would be on dangerous ground for legalizing recreational use, but he would be on relatively good ground on decriminalizing use. And that is keeping use out of the criminal justice system, but having enough leverage, for example, to make citations for public drug use that would mandate either substance abuse education classes or in certain cases counseling. Because if you give up all leverage, you are just going to create a larger population of people who are going to become dependent, who you're going to have more traffic crashes, and you don't realize what's going to happen, especially if you're not regulating THC. And put your attention on the regulation of THC if you're serious about changing the laws on cannabis. With medical marijuana, you're certainly on decent ground for decriminalization, and there are enough medical experts and addictionologists to be able to let you know what those rules should be, because there are certainly legitimate reasons. There's also a legitimate case to be made for allowing more research and experimental use of these substances for various medical conditions to make that easier. But I wouldn't want to be responsible for legalization. You're not going to save money in the long run. You're going to invite major corporations to come in, try to tobaccoize the marijuana business. You're going to invite the cartels in Mexico to invest in the marijuana businesses, which they're already trying to do. So there are a lot of unintended consequences. It sounds good for complete legalization. It turns out to be very, very problematic.
Dr. Cohen, have there been any studies as to the effects of legalization in places like Amsterdam and Denmark, where they're being legalized? You could buy it in a store and smoke it right there on the street.
The Netherlands has closed down their access to cannabis products, particularly to tourists and people coming from other spaces. They're doing a much better job of encouraging the stores that might be able to legally sell it for on-premises use to be alert to problem conditions. It's the same thing we kind of do with programs that teach bartenders how to identify alcoholics and people with alcohol problems, and the ability to test them for their blood alcohol content. So the Swiss also have kind of withdrawn the easy access to these chemicals. Now, ironically, the notion of medicalizing heroin, which has been an experiment in Canada, I think is very promising. So it's much better to have addicts access to either pure heroin or heroin substitutes under close medical supervision, rather than the needle sharing risk with HIV and the problem now of fentanyl, which is a drug that's used as a very, very, very powerful opiate that's used to make heroin seem more powerful and it's caused a lot of overdoses. So again, it's not that we want to criminalize the users, and it's not that we're asking them to stop completely if they're addicted. There are treatments, there are opiate substitutes, even potentially THC programs which would reduce the amount of THC used, as you might do with cigarettes and tobacco. So it's not a strange process. We just have to be reasonable about what we're doing.
Okay, thank you very much, Dr. Cohen, for sharing your ideas and your immense knowledge with us.
Thank you, Darius, for the fine, and Debjani for the excellent questions.
You don't